Are you a female struggling with infertility? Or maybe you aren't struggling with infertility, but you're struggling with hair loss or thinning of hair on your scalp, while at the same time maybe having increased growth of facial hair and body hair? Do you also have increased acne and moodiness, irritability, and or aggression? If so, you may be manifesting PCOS or Polycystic Ovarian Syndrome. Today I want to dig into how it's diagnosed, symptomatology, and causes. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Polycystic ovarian syndrome affects many women and is a cause of infertility. It's also related to weight gain, scalp hair loss, body hair growth, acne, moodiness, aggression, and irritability. Common signs and symptoms of polycystic ovarian syndrome, besides what I just listed, another common symptom is menstrual cycle dysfunction. So either you have on-again, off-again cycles, or you have no cycle at all. How is polycystic ovarian syndrome, or PCOS, diagnosed? Well, there are many different medical societies and associations that have different criteria for PCOS. One of them says it like this: there are 3 factors that they want to see to be able to diagnose PCOS. The first is that they want to see what's called hyperandrogenism, which is a fancy, nerdy, scientific word for androgen excess or androgen dominance. And your androgens would be the male hormones, as they're called. So you have lab high testosterone and or DHT and or androsterone, androstenediol, idiocalanolone, etc., etc. So the quote-unquote male hormones are lab high. This is seen as the highest priority need to meet diagnostic criteria, or the most influential one. Okay. The second and third are, you could have one or both of these. One is the oligo or amenorrhea that I mentioned, so menstrual cycle dysfunction. And the last one is PCOM, which is polycystic ovaries, or polycystic ovarian morphology seen on ultrasound. So they'd run an ultrasound of your ovaries and they'll see cysts or polycysts, multiple cysts on your ovaries. The body called the study where they published these criteria, they also added that they think anti-Mullerian hormone, or AMH, should be another factor that is considered when diagnosing polycystic ovarian syndrome. So these are criteria that should be met in order to call it PCOS. If you've gone to your doctor and they've run the ultrasound and they didn't see cysts, so they said you didn't have PCOS, that's not necessarily correct. That may be a false negative, because according to the Excess Androgen Society, who put out these guidelines, they say you have to have this and then either or both of these. So if all your doctor did was run the ultrasound of your ovaries and say, no, I don't see cysts, you don't have PCOS, that's not necessarily correct, because you may have the lab findings of hyperandrogenism and you may have cycle issues. So if they didn't ask you that, or if you don't have cycle issues or didn't mention cycle issues, then you may still have PCOS. Say you only have the lab findings and not cycle issues and not evidence of cysts on the ultrasound. Well, then technically you don't meet the diagnostic criteria to call it PCOS, but you may still have a physiologic shift or a trend in your physiology that is taking you towards PCOS that just hasn't gone far enough yet to meet diagnostic criteria. Does that mean that we shouldn't take action to halt that process before you get there? Absolutely not, right? We want to stop it as soon as possible. So in my mind, if you have the hyperandrogenism and you're noticing the acne and the hair loss or the weight gain or the irritability and those things, or the infertility, that's enough to take action. And what we'd like to do is take action by looking at the rest of your physiology, not be just super myopic on the androgens, but look at other parts of your physiology that research shows correlate with PCOS. So if we do that, we can say, well, what else matters? Well, we know that insulin is a big driver of PCOS. So if you have insulin issues or blood sugar dysregulation, that could be the root cause behind your PCOS. So until you address the blood sugar and the insulin, you may not get improvement in your cycles or in your fertility or in your acne. Another big driver is cortisol. Cortisol is one of our main stress hormones, the fight or flight hormone. So if you're under big time stress and always in that fight or flight, then that may be the cause of your PCOS. So addressing the stress triggers, whether it's job or relationships or nutrition or physical inactivity or overtraining, mental emotional things, environmental toxins, all of these things are stressors to the body, whether you are consciously perceiving them or not. So taking an inventory of whether or not those are part of your case is very important. Also, your liver. Your liver's ability to detoxify and clear hormones is very important. And as part of that, the liver clears your hormones, and so we want to know, well, what do your progesterone and your estrogens look like? Because you could have androgen dominance and you could have layered on top of that estrogen deficiency or progesterone deficiency, which makes the chasm greater and your hormone function or your hormone imbalance greater. So understanding all of those things is important. And then lastly, your gut is important. Because if your gut is a mess and that's driving chronic gut inflammation, that can lead to systemic inflammation, which then becomes a stressor, which can then blunt insulin receptor sensitivity, and on we go in a vicious cycle. So if you're someone that is struggling with infertility or struggling with hair loss on the head but hair growth on the face and body, can't lose weight, having that acne, your cycles are messed up. Well, if you've only looked at hormones and they're dysfunctional, but you've had an ultrasound that's clear, so they're telling you don't have PCOS, that may be technically right, but physiologically you may still be headed there, especially if you have cortisol issues layered on, or insulin dysfunction, or gut dysfunction, or liver dysfunction. So if this looks like you, if your pieces of your puzzle come together with a couple of all of these involved, then you really need to sit down and find a functional medicine practitioner that can do the detective work with you and figure out where are the linchpins in your case that need to be addressed, so that when we pull those out, everything falls back into place, and now you're growing and keeping your hair. Now the acne is going away. Now you can shed weight. Now your cycles balance out, and now you're fertile. If that's your goal, seek out a functional medicine practitioner that can help you determine, do you have PCOS, or a shift towards it, and what do you need to do to reverse it?